Now, another way in which you can use Scope is by using it with real patients. Now, picture this: you've started your clerkship or you started your placement. It's Monday morning. It's time to put your knowledge into practice with real patients, right? And you can do that with Scope Practice. And here's how you can seamlessly integrate Scope into your clinical workflow. Now, here's how you do that. You head over to Scope Practice on the left-hand menu bar, click on Scope Practice, and here you'll be presented with a screen that allows you to actually diagnose the patient that's in front of you. So navigate over to the differential diagnosis section, and here you'll see the groupings or the various chief complaint options that there are available. Now we're going to select headache. Now, for example, if your patient has frequent headaches, Scope can help you to differentiate whether or not it's an acute or chronic condition, for example. So you can select the appropriate category and further narrow down your differential diagnosis. So remember to include all possible diagnoses to cover all bases. So for example, we're going to select frequent headaches. Now, Scope aids in guiding your examination. So for instance, if you select migraine, Scope will prompt you to record symptoms and also signs as well. So we can select, for example, select frequent headaches, we can select nausea, we're going to select vomiting as well. And maybe you suspect that there is dehydration. You can actually now compare the differential diagnosis that there are as well. Now, Scope guides you through relevant physical examination steps. So once you've narrowed down your differential diagnosis, you can actually simulate ordering necessary tests and treatment. Now, this practice prepares you for making real-time decisions in a clinical setting. For example, you might want to simulate ordering a CT scan for a patient with severe headache to rule out any serious conditions like a brain tumor or hemorrhage, for example. So you can click on that. You might also want to select which treatment that you want to actually provide the patient as well. So you can select ibuprofen, for example. So it actually gives you the ability to actually select tests as well as treatment.